Happy Wednesday and welcome to another episode of FIBO USA's webinar series. Today's session is powered by one of our industry partners, the Medical Wellness Association. I am looking forward to hearing about how to use the power of nutrition to enhance the immune system and counteract inflammation based on the key findings of our speakers' clinical trials. My name is Maike Kumstel. I'm the Industry Relations and Content Manager for FIBO USA and today's host. Before we start, I want to share some housekeeping notes with you guys. First of all, I want to let you know that we are recording today's webinar and that we are sending out an email with the recording to you tomorrow. If you're having difficulty hearing us and are listening through your computer, please check that your speaker volume is turned up. If you're still facing issues, you can message us using the chat box, which is located on the right side of your screen. Feel free to ask questions at any time through the same chat box as well. And now I would like to introduce today's speaker, Dr. John Lewis. Dr. John Lewis is the co-founder and CEO of Nourish Me, Associate Professor in the Department of Psychiatry and Behavioral Sciences at the University of Miami Miller School of Medicine, and faculty member and advisor of the Medical Wellness Association. He has been the principal investigator of multiple nutrition, dietary supplement, exercise training, and medical device studies in the last 2 decades. He mainly investigated the effects of interventions on a wide variety of outcomes in healthy adults and in those with conditions such as Alzheimer's. Besides multiple publications, he presented the results of his work in Alzheimer's in a talk for TED Miami. As you can tell, he clearly is an expert in his field, and we are very honored to have you, Dr. Lewis. The stage is all yours.
Thank you so much for the kind introduction. For anyone who would like to contact me after the webinar, feel free to do so. Here's my email address and my phone number below. So also, I'm happy to answer any questions at any time you may have as well regarding our work in nutrition and dietary supplements and any other questions you might find of interest. So the field of nutrition and the fields of immune function, immunology related to inflammation as well are huge. So I'll be narrowing down the information today in some pretty directed content, just because it would be impossible to really do service to all these different concepts with any level of detail. It would really only be a broad stroke to try to comprehensively talk about all of these concepts in one talk. But I get into it, I just want to always acknowledge the folks that I've worked with in my career, particularly all the people who've helped me conduct this research at the University of Miami. I've had just some great colleagues and partners over the years, particularly Dr. Reg McDaniel, who got me into this whole area of polysaccharide research that I'll talk about. And then a patient, Miss Barbara Kimley, who was a cancer patient at our university as well. She also introduced me to hydrolyzed rice bran or bio bran that I'll also talk about in this lecture today. So, and also obviously the sponsors who have made all of our research happen, as well as the participants. Without people actually participating in the research, then we would have no research. So I'm grateful to all of these folks who have helped me over the years. The concept of nutrition being fundamental to our health is not new at all. Anything that I could come up with today, a theory for why nutrition is important, would be actually very late to the party. So I can imagine most people have heard this quote, "Let food be thy medicine." This was said by Hippocrates, the father of modern medicine, and he said this before our calendar, before the Western calendar even started. So imagine at that time having no access to technology, the scientific method not even being understood at that point, but still understand that food was so critical to human health. The guy clearly was a brilliant man, and to be able to to say that so long ago was quite profound when you think about it in those terms, in that context. Another fellow who is not as famous as Hippocrates, but who I would argue is one of the pioneers when it comes to the human health condition, and that is Dr. James Lind. He's a well-known figure in the British Navy back in the 1700s. You can see from the dates when he was alive. Dr. Lind discovered that using citrus, you could prevent or cure scurvy back in those days, and in the context of what the United States became, it basically allowed the British Empire back then to dominate the world, because none of the other countries had figured out why humans were dying of scurvy. And so with the use of lemons, limes, oranges, Dr. Lind was able to figure out that not only could you prevent scurvy in the first place, but you could actually reverse it for those who were ill. So this finding allowed, again, the British Navy or the British to dominate the world for a long time before the other countries figured this out. And he's also probably the reason why we speak English in the United States today, because of discovery. So again, I point out that nutrition is power, and if you utilize nutrition properly, you can actually do lots of things and be really healthy in your life. So today, globally, we have epidemics of all types of chronic diseases, and if you're not aware of those, I mean, it's really crippling not just the United States, but again, this is a global problem, not a United States problem, not a first world problem, not a developing world problem. It's a global problem. There are literally epidemics of all of these chronic diseases that I would say, as far as the United States go, is probably the biggest threat to our national security. Chronic disease far outweighs anything related to any other effect, be it environmental issues, terrorism. Now we're dealing with all of these social justice issues. All of these things pale in comparison to what chronic disease is doing to us. And it's really sad that we don't have to be doing this to ourselves, but unfortunately, due to very poor nutrition and people becoming increasingly sedentary due to technology and other factors, now we are just literally crippled by chronic disease. This is the national security threat of today. Again, you can see these trends in obesity over the last 50 or 60 years. We now have women in the United States that are roughly 40% obese, maybe even just a little bit more than that. And men are now over 35% obese. This is according to body mass index. So I would challenge anyone to tell me that this is due to genetics. You know, we always hear about, well, it's a genetic issue. No, it's a behavioral issue. It has nothing to do with our genes. Our genes did not shift over the last 40, 50 years to say, okay, now it's time for humans to be fat and sick. Our genes don't work that way. Our genes are directed by what we feed, primarily information through what we put in our mouth. Obviously, exposure is also an important part of that. But again, it contributes to this notion that behavioral is really the issue here. And I'm mentioning these things in context because we really can't talk about inflammation and immune function without setting up the context with why this is so important today. Again, what are some of these key factors driving chronic disease? Well, I've already mentioned the issue of food. Food is arguably, if you look at the literature, food, nutrition, dietary factors, dietary behaviors, without question is the #1 modifiable risk factor related to all these various chronic diseases that have an inflammatory undertone. Now, smoking obviously is still significant when it comes to certain types of either cancers or cardiovascular disease. Clearly, smoking dominates the risk factors in those specific diseases, but in general, nutrition being absolutely the most critical factor here, and way more important. You know, a lot of times we think of exercise being so important. It certainly is, but exercise, again, even pales in comparison to the effect of nutrition. Mentioning just a little bit more about what's happening with nutrition, or what's not happening actually, in terms of the standard American diet, which some people refer to as SAD, and it certainly is a fitting acronym, in my opinion, based on how sad we are today with all of this chronic disease. So you have all of these factors here, really not in any particular order of importance, but just a list of different things that people are typically eating, whether it's too much sugar, too much fast food, too much processed food, too much animal food, too much of the wrong kinds of fatty acids. Again, there's a whole host of reasons, even alcohol, although don't commonly think of alcohol as a food, but certainly it's an issue with behavior, and whether or not you're drinking too much alcohol certainly is a driving factor for many types of cancers, particularly for women. Inflammation was a term that was coined not too long ago, so it's sort of the intersection between inflammation and aging. And you note that you see certain points here on the skeleton where they're inflamed. That's just simply a representation for this notion that systemic inflammation is a contributing factor to, again, these chronic diseases that are just crippling us today. And we can't really talk about any of these chronic diseases. I mean, you can go to any aspect of the medical or health literature, and you won't find any discipline or branch of this that doesn't have research now pointing in the direction of how crucial controlling systemic inflammation is to reducing these risks of various chronic diseases. Now, as a side point to the chronic systemic issue, you also have inflammation that's a good course. We need inflammation in acute trauma. When we get sick, when we get infected with something, we want the immune system to be surveillant, and we want that inflammatory effect. That's actually the other type of immune system that we typically don't talk about. But we should not ignore that, because that type of inflammation is very important. It helps to heal us. If we didn't have that response, then we wouldn't survive some of these acute situations that we get exposed to. But it's the chronic inflammation that becomes a problem, where we have a dysregulated immune system over time when we continue having, whether it's, again, poor diet, being sedentary, not dealing with stress properly, not sleeping enough, exposure to toxins, chemicals. There's, again, a whole host of things that cause this chronic systemic immune response and also inflammation. So again, it's important to get that under control and to be able to manage that. Immunosenescence is just a concept to suggest that whether it is normal aging or even premature aging, immunosenescence just simply means that the immune system is no longer surveillant, it's no longer responsive, it's no longer able to take care of you like it should. Now, ideally, as we're growing, when we're a child, through our teen years, through our early 20s, our immune system is continuing to evolve and develop. And again, that's driven by a whole host of nutrition being right at the top of the list in terms of creating a healthy immune system for yourself. But then once we hit that peak in life, typically physically, we're talking for most people somewhere in their early to mid 20s. Then after that, unfortunately, we do begin a gradual slow decline in our functioning, in our abilities, and not the least of which is our immune system. So among all of these discoveries about inflammation, there are also discoveries being made about how the immune system works, and again, why it's so important and how it actually interacts and corresponds with all the other major organ systems at the same time. So a lot of times people don't think of the immune system's importance, although right now we're dealing with this COVID-19 situation where people are much more aware of immunity and how to maintain immune health. That's actually a teaching moment, as psychologists would say. It's a good teaching moment to help people understand that. But normally, in my experience, I don't know about you, but most people don't think about the immune system the same way they do, say, for example, the heart or the brain or the kidneys or the liver, any other major organ system where you feel something tangible. Immune system is in a way sort of ethereal, because you don't really look at the immune system the same way you do it in another organ. You look at the immune system in cells in our blood, and so it's much more difficult for people to conceive the importance of the immune system, not the same way they can, say, for example, a pair of lungs, when you see them in an exhibit where you see a pair of lungs from someone who didn't smoke and a pair of lungs from someone who did, and you can see a very stark response to cigarette smoking and how damaging it was to that individual's lungs. Same thing for a drug user or an alcoholic who has a much smaller brain than somebody who didn't become an addict. So there are very obvious examples of how our organs by bad behavior, whereas with the immune system, again, it's much more difficult for people to recognize that. So I want to really stress the fact that immunosenescence is a key concept to all of this, because even with aging, even with normal aging, even being healthy and not subjected to chronic disease, your immune system still needs support. And we do that primarily through nutrition to be able to help it be functional and continue to be surveillance and protect us. I want to make sure that I'm staying aware of the time here. So just put a clock here. Again, I would argue that, this chronic disease management system that we have in the United States is really a very crippling factor to our national security. We're now spending somewhere around $3.7 trillion per year in this system, where we don't really deal with acute situations. We're actually treating chronic diseases that could largely be prevented excuse me, if they ate well and if they exercise primarily, those being the two most important factors. But again, all of this is with an underlying tone of the importance of immune functioning and inflammation. And we just don't have, unfortunately, we just don't have a system set up where we're educating our clinicians, we're educating even the public about prevention and health. We're always focused on treatment. And so getting us to a model of prevention is also part of my goal, and what I've done and what I'm choosing to do with nutrition. It's very important to think about prevention. We don't want to be sick in the first place. So it's very important to think about this, not only in your individual life, but really how your behaviors affect the larger world. And no one is living on an island. So thing that we do, each behavior that we engage in, has a trickle effect in some direction, whether it is up or down. And so it's important for us to take responsibility for our own lives and manage our own health and take care of our own health. I really cannot stress that point enough. So let's get right into the meat of the matter here, if you will, in terms of looking at some of the work that we've done over the last almost decade and a half. It's been a long line of research that Mike mentioned that I've been doing in a few key components of nutrition. Again, I can't go over a broad approach to this without giving the topic any amount of detail in an hour lecture. I really want to drill down into some key points here, because I believe I will share with you some concepts today that you may have not heard of unless you have, like myself, been focused in this particular area. And it speaks to the breadth of the knowledge base in nutrition. I mean, when you think about specialists in the field, how many people can know everything there is to know about vitamin C, for example? I mean, it's literally impossible. So it's good that we have specialists in certain areas, because otherwise, literally, there would be so much potential and so much information never discovered without people being able to specialize in some of these key areas where you may find discoveries that are potentially beneficial to millions of people. And in that respect, polysaccharides, the story of polysaccharides, the field of glycobiology or glycomics, how these saccharides interact and are used by every cell in the body, has been going on at least for the last several decades. And so I'm just one of many people looking at how these polysaccharides are so beneficial to us. And I use the word polysaccharide very specifically. I could have said sugar, but if I said to you, well, guess what? Sugars are good for you, you probably would laugh at me, because unfortunately, in a way, we've been sort of brainwashed by the media, by the mass media, to believe that sugar is all bad for you. Well, guess what? They're not. There are many sugars that are very good for you, but the more key technical biochemistry term is a saccharide, as opposed to the layman term sugar, and that's why I specifically said that. But again, to say all sugar is bad for you is throwing the baby out with the bathwater. You cannot say that, because some of these very key complex polysaccharides or oligosaccharides are incredibly beneficial to us. Now, they're not essential, meaning that the body needs them from the diet. So in other words, if something is essential, that means you have to consume it. If something is non-essential, the body can take what you give it and then recompose it or recreate it into something useful. So in this, these sugars are non-essential. The body can take some of the more common sugars like sucrose, glucose, high fructose corn syrup, and recreate those into some of these polysaccharides or oligosaccharides that we use in more functional ways. But nonetheless, the one of the theories that my colleagues and I have is that because we're no longer getting some of these complex polysaccharides in the diet, the way, say, 100 years ago, most humans were working in a field, they had their own farm or their garden, and they were growing their own food. As we've moved away from that, as we've moved into technology and information and all these other specialties, most people today now do not grow their own food. At least I don't know of anybody growing all of his own food. I cannot name one person I know doing that today. But these polysaccharides now no longer show up in the foods that we do buy at the grocery store. And so, or I should say, very few of them do in terms of comparison of content, again, going back to, say, 100 years ago, around the turn of the 20th century. So where do some of these polysaccharides come from? And here are a couple of them that I have listed, but in particular relationship to the research that I've been doing, the two key ones are definitely rice bran and aloe vera. Now, you may think of aloe vera in particularly as something that you would use topically, which it's true. We know that humans have been using aloe vera topically for many thousands of years, and you think, oh yeah, it's great if I get a sunburn or if I cut myself or if I have some wound, then I'll put some aloe vera gel on my skin and it'll help it to heal. Well, certainly that's true. But guess what? Aloe vera is actually much more potent if you take it orally. Now, I'm not talking about the pure gel. Unfortunately, the pure gel is about 98.5% water. So you'd have to take a whole lot of gel to get a concentrated amount of polysaccharides to actually have a physiological effect. So that's where something like a dietary supplement, like one of the products that we use and sell, is so beneficial, because the dietary supplement takes the benefit of nature and then actually combines it with technology, with an extraction process, getting it down into a very concentrated form, and now you can consume that orally where it can do its magic. Same thing with rice bran, even though, and I'll mention this a little bit more later, but rice bran is also incredibly nutritious, but you don't think of it as being so effective for the immune system. And I'll show you again in just a little bit why that is the case. And then the yam here also, again, is loaded with various polysaccharides. So these are just an example of some of the foods that have these key ingredients. So I just mentioned rice bran. Well, actually, there's a particular type of rice bran that's even much more beneficial than just rice bran itself, which has a whole lot of nutrients, phytonutrients, cofactors, enzymes, elements, you name it. I mean, it's literally a powerhouse of nutrition, excuse me, but a hydrolyzed version of it or form of it actually is something really special for the immune system that I'll get into. So again, as you can see here, over the last several years, we've conducted 3 different clinical trials with this particular product. Healthy adults with no known infections or conditions, people with HIV, and then people with alcoholic fatty liver disease. Obviously, we know the story of HIV that's been going on now for several decades. The issue with fatty liver disease is actually a newer one, although it's maybe not as significant as HIV yet, but it's actually becoming very important, and I will share with you just a little bit more about that as we get into it. So again, going back to crude rice bran, it's a very large molecule. It typically has, comparatively speaking, low absorption. Absorption, I mean the concept of bioavailability, which is also very important for not only for the foods that we eat, but also for the dietary supplements that we take, because bioavailability is just simply the ratio of how much you consume, how much you put in your mouth, and how much is actually absorbed in the gut and then gets into the bloodstream to go to the target cells to do its work. So again, we typically think of rice bran as having a lot of different nutritional value, but not necessarily so key or significant to immune function. Well, guess what? When you take rice bran and then you hydrolyze it with shiitake mushroom enzyme, what appears to happen is the molecular weight is lowered, and now this becomes a signaling mechanism for the immune system. Now think about that for a second. I mean, this is really getting into the nuts and the bolts of how powerful food is when you think about the ability of food, or in this particular case, hydrolyzed rice bran, to actually turn on your immune system to do something for whatever purpose, whether it's combating an infection, counteracting carcinogenesis process leading to cancer. I mean, these are two very critical functions that the immune system does. So to be able to do that is quite profound when you think about it that way. And really, that is the biochemistry of life. I mean, that fundamentally is the chemistry of life, when we put things into our mouth, which then activates or modulates our immune system to be able to be functional and to be a system that protects us to be healthy, to have us be healthy. So in this particular study, it was a 60-day trial. We looked at 2 different doses of the rice bran, 1 gram per day and 3 grams per day. We had a whole host of different biomarkers that we looked at, including immune function, inflammatory markers, and protein and bilirubin and other things that we normally look at for whether or not the liver and the kidneys are also healthy. And that's very important in most dietary supplement studies. You want to look at these, we call them safety measures, to make sure that a particular product has no negative impact on the liver and kidneys. Those are obviously very important. And then we looked at the comparison between these groups. And by the way, I'm happy to share any of these papers with any of you. If at any time, I can send you the PDF. I had my contact information on the first slide. I'll have the contact information again at the end. So this particular graph here represents actually perfect, true immunomodulation. When I first saw this, I really could not believe what we had discovered. So this is a measure of natural killer cell functioning. Again, if you know anything about the immune system, you know that our natural killer cells are one of our first lines of defense, whether it's against some sort of an invader, a pathogen, a virus, a bacteria, or whether it's against cells that are transforming typically into something carcinogenic or on their way to cancer. So we want our natural killer cells to be very surveillant, very responsive, and very active. If they're not, then that typically means we have immunosenescence, or our immune system is not functioning properly. So look at this curve here. At baseline, you have that value, whatever that may be at baseline. Again, these are in healthy people. These are not people with HIV or cancer or whatever active disease, but it's at this baseline value here. It starts going up a little bit at 48 hours, and this is for both groups, 1 gram and 3 grams per day. Then it peaks at 1 week, and then it returns back to roughly baseline. Now, for statistical comparison purposes, the value here at 1 week is greater than any other point in the 60-day trial. And the two treatments were not significantly different between themselves, meaning that basically whether it was 1 gram per day or 3 grams per day. So think about this from a practical point of view. What happened here? You started with the rice bran. The immune system got turned on, again, because of this very key molecule here. It peaked at 1 week. It said, okay, we're ready for action. We're ready to fight. We're ready to protect you. Nothing is there because these are healthy people, and it went. That is the definition of true immunomodulation, meaning that the immune system was turned on, but there was nothing to fight, and it turned back off and went back down to baseline. Again, amazing immunomodulation. I could not have designed that graph any more perfectly if I had drawn it. I mean, I could not believe the data we got there. And then some of these key inflammatory markers here, TNF alpha, IL-6, they've been studied widely in things like cardiovascular disease and cancer. We basically showed a lowering of both of those two key molecules. MCP1 is a protein the immune system secretes for cancer surveillance, meaning it wants to look for cancer and go and fight those particular transformed cells. You can see it going up over time. And then VEGF, another key inflammatory marker typically looked at for cardiovascular disease, and you can see it reducing as well. So when you take these 4 things in combination with what I showed in the slide, it's a really nice picture of not only modulating the immune system, but also lowering some of these inflammatory markers while increasing your marker of looking for cancer surveillance. I mean, to me, those are a beautiful, beautiful data here that show something really nice going on with this particular compound. Next study, again, for the non-alcoholic fatty liver disease. Now, these are people diagnosed with this condition not due to alcohol drinking. I mean, you notice in the name, it specifically is for non-alcoholic fatty liver disease. The interesting thing about this disease is you do not have to be overweight or obese to have a fatty liver. That's only typically 20 or 25% of cases, but nonetheless, just because somebody isn't overweight or obese doesn't mean they cannot have fatty liver, and that would simply be due to, some part of your genetics where you store fat in the liver as opposed to, say, in your viscera or other parts of your body for whatever reason. And obviously, typically, a lot of that would be dependent on your diet and probably secondarily lack of physical activity as well. Again, we looked at a whole host of different biomarkers in this study. It was also a short-term study as well. It was a 90-day study compared to a 60-day in the first study. But in this case, we looked at a comparison group of a placebo, which we did not do in the first trial. And then this was using 1 gram per day of the rice bran as opposed to the previous trial where we used 1 and 3 grams. And then we compared the outcomes between each group. Alkaline phosphatase is one of the key liver enzymes. It's definitely a marker that you want to look at. If you already have non-alcoholic fatty liver, you want to look at these liver enzymes because ALP is one of the key markers to look at for progression of liver disease. So going from non-alcoholic fatty liver disease to liver obviously is a much worse prognosis. So if you already have fatty liver, one of the things that you want to do is try to prevent the progression. Now, one thing I didn't mention as I started on this study is that currently there is no conventional medical treatment for non-alcoholic fatty liver disease. If you're a patient with this condition, you're probably told to lose weight. Well, guess what? How effective is losing weight? People, millions and millions of people are literally struggling all the time with trying to lose weight and get under control. That is one of the biggest mysteries and one of the biggest scientific issues out there known to exist. So many studies have looked at all these various ways of trying to get people to lose weight. So it's incredibly difficult to get people to not only to lose weight, but then to sustain that weight loss. So if you're faced with this condition, even if, again, you're not overweight or obese, but you have a fatty liver, you're going to be told by your physician to lose weight. That's basically what you're told today. So like with most diseases, there are very few conventionally efficacious options for you when it comes to this condition. So look at what we showed here. With the hydrolyzed rice bran in the blue, we have a nice decrease in the ALP, whereas in the placebo group, it continues going up. A really, really nice finding for this liver enzyme, again, being a key factor in looking at progression of liver disease. Next, we looked at the eosinophils. Now, in combination with the next slide, the monocytes, keep these two in mind together as I discuss both. I'll sort of jump back and forth because you can see basically similar trends in each one. In the eosinophils, again, in blue, you see the rice bran group going up statistically significantly, whereas in the placebo group, they're going down. In the monocyte group, a definite significant trend in the rice bran group, whereas the group also goes up a bit, but then at 45 days to 90, it plateaus. The reason why I'm jumping back and forth is because normally what we would say is that we do not want to overstimulate the immune system when it comes to any kind of condition. But actually in this case, because we're talking about a 90-day trial, what some other research has showed is that when you actually have a short-term stimulation of the eosinophils and the monocytes, this is actually very good for the hepatocytes or the liver cells. So there is research to suggest that this is very supportive of liver health, and it's a good thing because you're actually turning on the immune system in the short term to hopefully help get the liver back to a healthy condition. These two slides I'm showing in conjunction as well because neutrophils and IL-17 have been shown, again, through other research to be related to each other in the sense that neutrophils actually secrete IL-17, and it makes sense when you look at both trend lines. Both are going down, whereas the placebo in the case of neutrophils is basically staying the same over the entire study period, whereas it kind of peaks at 45 days and then goes down again for IL-17. But nonetheless, this is a nice finding that's parallel, and it suggests that actually, again, this is supportive of overall immune functioning where you have this decreasing marker of IL-17, which was actually shown in a couple of previous studies with BioBran or hydrolyzed friend in 2 different rat studies where they actually created liver disease in rats, and then they showed that BioBran was able to reduce IL-17 as well. So again, this is an overall effect, a net anti-inflammatory effect here with this IL-17 marker. Gamma glutamyl transferase is again another very significant clinical marker where the patient, if the patient has a value over 50, that's considered very, very, very. And so to be able to get that value back below 50 is clinically significant. And again, drugs are not able to do this. So we're showing with hydrolyzed rice bran, you can see at baseline, both groups were over 50. The placebo group stays higher than 50, much higher than 50. And in fact, at the end of the study is actually increasing. Whereas with the BioBran group, it's actually now below 50 at 90 days. This is probably maybe the most key factor here in terms of, again, clinical diagnosis, clinical prognosis, and keeping the liver from advancing into something like liver cancer, which would be the worst case scenario. IL-18 is another marker that's important for inflammation. Again, even though it did elevate a bit from 45 to 90 days, overall from baseline to 90 days, it was going down, and then it had this sort of odd U-shape appearance, reverse U-shape in the placebo. This marker wasn't as easy to explain as some of the others, but nonetheless, it does have an overall effect, which is a good thing because, again, IL-18 is important in looking at inflammation in the context of liver disease. So overall, we had just really beautiful findings from that study. Now, the final study, the HIV study, it's actually interesting because initially when we started this study, we were looking at some of the more metabolic syndrome markers, if you will, things related to body fat distribution, body composition, and even blood pressure, of course, and lipids, again, fitting within that spectrum of metabolic syndrome that goes from metabolic syndrome to either diabetes or heart disease or both. What turned out to be the case with our study, though, was that those markers didn't end up being that significantly different. What we found was that, again, with BioBran, it was so crucial to immune function and inflammation, and I'll show it in just a second. But what we looked at was people with HIV on stable antiretroviral therapy, and then we looked at the difference between 3 grams per day of BioBran with placebo. And then very quickly here, CD4, which has classically been the hallmark of immune functioning for people with HIV, it basically did not change. It was very stable for both groups. That wasn't really a very exciting find, although you could make the argument that BioBran actually helped to keep CD4 roughly where it is. However, the more exciting findings were the fact that the CD8 cells went down and the placebo group went up. So CD8 is actually much more important than what it was, say, 30 or so years ago when the research on HIV was not as well known, and now there's been so much more information published. But actually, you do not want to have CD8 cells to be overstimulated with people who have HIV, simply because what that does is it ends up predisposing them to having a greater risk of cardiovascular disease and cancer. So this CD4-CD8 ratio becomes very important. And so much like in the gamma glutamyl transferase example in fatty liver disease, the CD4-CD8 ratio in HIV is also very significant. So for that, you want to have somebody above 1.0 where you have a lowered risk of heart disease and cancers that I mentioned earlier. So look at what happened over the course of the study. At baseline, both groups were just above 1.0, just below 1.0. And then in the BioBran group, it did dip just a bit at 3 months. Same thing happened with the placebo group. It came down even more. But then look at what happened at 6 months. It got above 1.0. I tell you, according to the research, about 80% of the time, the infectious disease physician rotates the medications that these patients are taking, and it doesn't work. It's almost, I shouldn't say almost never, it's again, 20% of the time, rotating the medication will get that ratio above 1.0. So 80% of the time, this does not work. There has not been any other dietary supplement, nutritional factor, nutrient, phytonutrient ever to show this particular finding. This is a completely novel finding in the literature. Nothing else has shown this. So to get this CD4-CD8 ratio back over 1.0 over a 6-month trial with this BioBrand, again, blew me away. I could not believe the finding that we had from this study, and it was just so impressive. I was, again, probably one of the most meaningful findings to me in my research career so far. So quickly, just some on BioBrand or hydrolyzed rice bran. I've already mentioned to you that it optimizes this natural killer cell ability. It improves a host of different biomarkers in addition to natural killer cells. It looks at all these different cytokines, or it affects all these different cytokines and growth factors. It looks at, we've looked at different oxidative stress markers, other immune system markers, literally just incredible findings over the course of these 3 clinical trials that we conducted. And that doesn't even take into consideration the somewhere around 50 studies that have been conducted, maybe even more than that, from investigators all over the world. I mean, I'm just presenting you the data from our lab, but there are investigators in Japan and other parts of Asia and Europe and Australia, literally all over the world. People are looking at this product, showing what amazing capacity this thing has to reduce inflammation, enhance the immune functioning. It does not have any side effects. We did not document any side effects in the 3 trials that we conducted, and it does not demonstrate hyporesponsiveness, meaning that it modulates the immune system so that you don't become either immune to it itself or you don't develop a tolerance for it. So it's always capable of modulating the immune system, whether it needs to be a little bit stimulated or a little bit suppressed. It's almost actually like an adaptogen when you think of other key molecules that have been studied on that level. So just really an incredible product. I can't tell you enough how important this product is when you think about immunomodulation. So I just mentioned some of those terms as well. And I guess the other one to really think about is, in addition to having no side effects, is also that we haven't shown it to have any negative interactions with either medications or any other type of dietary supplement. So again, you're talking about a powerhouse product here that has the ability to do a lot of really amazing things for the immune system, and including lowering inflammation. Next, I'll jump to staying along the same lines of this polysaccharide story, but using it from the aloe vera story. Now, this is another line of research that I've been conducting during this last almost 15-year period. And I'm going to show you the results of 2 different studies that we used with this particular complex, one in folks with Alzheimer's disease and one in folks with multiple sclerosis. When you think about all these neurodegenerative disorders, again, much like with non-alcoholic fatty liver disease, basically conventional medicine has nothing for these folks. I mean, this has been an ongoing dilemma for a long time now. And in fact, it's been now, I think about 1.5 years ago, Pfizer eliminated their entire drug discovery program for neurodegenerative disorders, which was primarily Alzheimer's and Parkinson's. Basically, they said, we're done. We're not spending any more money. They laid off, I think it was like 1,300 employees, and they basically canceled that program. So imagine if you have Alzheimer's or Parkinson's, or you have a family member who does, what kind of message that sends, where basically a large company like that is giving up. So that's how unbelievably difficult it is to deal with these disorders, either from a very purely conventionally medical perspective, or even from other perspectives for that matter. So why are these polysaccharides important? I left this for this particular part of the talk, not prior to the rice bran talk, simply because the aloe vera in particular has one of these key polysaccharides in it. If you see here, this mannose molecule, we know that, and this is a representation of most cells in the human body. It isn't meant to be, cause anybody to have a headache or anything, but basically this is a graphical representation of every cell in the body, where I want to simply focus on, regardless of whatever your cell is doing, whether it's talking to another cell, creating some new type of molecule or compound, or whatever it's doing, it needs these elements and compounds in certain key points, particularly from the endoplasmic reticulum to the Golgi, when these processes are occurring. Again, this is directed by our genes. The genes do nothing until they receive this information from the environment. So through the field of glycobiology, we know that these sugars, these polysaccharides, are needed in very specific ratios every time the cell does something. That's how important this is to our well-being. Again, this isn't just about the immune system. This is literally about every single function your cells do, going from the cells to the organs to the organ systems going to you. So this is everything about you. And it could not be more true when you say you are what you eat. Literally every time you put something into your body, the body is breaking that food stuff down into those components to get it to the cells to utilize to function properly. So these nano sugars from aloe vera in particular, where have been shown to be these ACE mannan sugars, these nano sugars are so concentrated. Once you extract out the water from the aloe vera, now you're left with polysaccharide and a few other things. That's why aloe vera is so beneficial to humans. And forget rubbing it on your skin. That's fine. Forget taking these liquid products, these gels for stomach issues and whatnot. That's okay too. I'm talking about the polysaccharides, the actual powder part of the aloe vera that you can see in the gel, but getting it into a concentrated form, into a powder, that's where you can do magic for yourself. And by the way, this isn't a miracle. This is actually just giving the body the raw materials that it needs to function properly. I want to mention a case. This was from a colleague of mine that worked with me on the Alzheimer's and the MS studies. He was treating a patient at hospice, and you know what hospice is. Hospice for most people is typically where you end up before you go to the funeral home. It's usually the last step before death for most people. This patient had metastatic liver disease. You can see on the left here in July of 1999. He had cancer originating from the liver, metastatic cancer. He had surgery, chemotherapy, radiation, the whole 9 yards, was still sent to hospice to die. After a year of taking these complex saccharides, you can see how much smaller the cancer had gotten. He ended up leaving hospice. That's how powerful the body is when you give it the raw materials that it needs to function properly, to turn on the immune system, to turn on the stem cell making process, to lower inflammation, to do all these things, to actually heal itself. And that's what some of these people who had in this particular hospice facility the opportunity to take these saccharides, and some of them ended up leaving hospice cancer-free, and some of these people are even alive today. So do not ever underestimate the value of what nutrition can do for you. So very quickly, Alzheimer's disease is a significantly huge problem. It's only growing worse. Again, the FDA has 5 approved drugs for dementia. They basically cannot do anything for you. If you have it, if you have this terrible disease, these drugs may delay decline for you for a few months. But then after that, you keep falling off the cliff. There is really nothing that can be done from a conventional perspective. It's the 6th leading killer of Americans. There's no preventative strategy. Hell, we don't even know exactly what causes Alzheimer's disease. It's really, when you talk about mysteries in the medical community, this really is one of the biggest ones. So the personal health and well-being side is tragic. And then it's also, again, one of these diseases from a financial, societal perspective that is also just simply wiping us out. And we only have in the United States about 5.5 million people with Alzheimer's. We have of the other types of dementias combined about 13 to 14 million, costing us somewhere around $500 billion per year. I mean, you're talking out of a country of 330 or so million people, a very small percentage. It's not like the number of people with diabetes or heart disease. So you're talking about if this thing continues getting out of hand, this one disease alone could cripple the United States. And that's not hyperbole. That's actually a true statement. It's just unreal. So we looked at people with moderate to severe disease in this study. We looked at people over a 12-month period. We didn't care what medications they were taking. We didn't care what other comorbid conditions they were taking. Big Pharma is not interested in that subject. Big Pharma only wants to look at people who have maybe mild cognitive impairment or maybe early stage of disease. We also took people who had been diagnosed at least for 1 year. I think the average in the study was about 3. Excuse me, these were people about 80 years of age. So these were very old people, very impaired people, had been sick for a long time, typically could not have anything done for them by conventional treatment. We gave them 4 teaspoons per day of this product, and then we looked at outcomes at baseline, 3, 6, 9, and 12 months. We only had the funding to do blood draws at baseline in 12 months, but I want to focus on what happened here in the immune functioning. But first, I just want to show you, again, if any of you have had a family member or know somebody with Alzheimer's, you know that your cognitive functioning just continues declining to the point where you die. Well, again, the drug studies basically show no improvements in cognitive functioning. You might have a delay in decline for a few months, but we actually showed improvement in cognitive functioning. Now, maybe this looks counterintuitive because the graph is going down, but actually in this case, according to the ADAS-Cog, which is the most widely used measure of cognitive functioning in all dementia studies, it's probably been published in, I don't know, several thousand articles, but in this case, actually a score closer to 0 means you have no cognitive functioning. I'm sorry, no cognitive dysfunctioning. So you actually want this score to go down. So we showed clinically and statistically significant improvements at both 9 and 12 months. When I saw this for the first time, I literally couldn't believe it. I was so overwhelmed, and I was getting responses from the caregivers calling me up in tears saying that their loved one was doing things that he or she hadn't done for years. I mention this in the context of this disease simply because I couldn't go forward without just only talking about the immune functioning part of this without failing to mention the cognitive functioning part would be a short-sighted in my opinion. So I want to show you how, again, this ability of the body to turn on itself when you give it the raw materials it needs to function properly. With cognitive functioning here, I mean, we had people that were literally remembering names, remembering anniversaries, family members, friends, things that they hadn't done for a long time. I could not believe what was going on in this study. It was really that profound. And then we showed a couple of key things here with TNF alpha and VEGF, which were markers that I mentioned in our previous studies with the BioBran or the hydrolyzed rice bran. They also were lowered. And then you had about an increase of 3% of this CD14, which is a marker of adult stem cells. Now, our adult stem cell making capacity declines as we age. Unfortunately, like with everything else, we lose that capacity to recreate ourselves. And that is one of the hallmarks of aging, of immunosenescence, is this ability to produce stem cells. And one of the reasons why we do live from day to day is because we are constantly regenerating ourselves. So imagine these are people about 80 years old with a really severe disease, and they actually showed an increase in about 300% of this adult stem cell marker. So when you take the cognitive functioning and combined with the cognitive functioning improvement combined with lowering inflammation, combined with turning on the stem cell making process, again, we were blown away. And that first article, we published now 3 articles from that study. That first article was published in 2013. I have still even yet to see anything remotely close to that published in this particular field of the medical sciences. And so we showed something really, truly remarkable with this study. And again, speaking to the effect of how these polysaccharides are just so important and so crucial for the body and for people that have such, a terrible chronic disease. The last study I'll talk about today is the study on MS. It was in people that have this, basically conventional medicine has no treatment for. There's nothing that can be done from a conventional perspective. You can modify the symptoms, you can perhaps improve quality of life to some degree, but that's not conclusive as well. And so, again, when you come to this type of disease, you really have nothing from a perspective to deal with to help people. So we looked at basically the design as in the Alzheimer's study. We looked at the effect of this formula over a 12-month period. We assessed people in the same amount of time in terms of different quality of life and functioning assessments. But for this particular talk, I'm just focused on the immune functioning and what went on with infections, which if you don't know, infections is one of the most significant, if not the most significant side effects of having MS. When you have MS, your ability to fight off infections is very impaired, and unfortunately, many people with MS die of infections of various types. So if you look right here from baseline to 12 months, you can see a huge drop in the total number of infections. And by the way, not only are infections one of the leading causes of death with people with MS, but it's also incredibly expensive. So it's costing the medical care system a lot of money to deal with all these different types of infections that people with MS. And then jumping over here to this slide regarding immune function and inflammation, you can see several different markers here that improve statistically significantly. IL-2, IL-1 beta, these have both been looked at classically in a lot of cardiovascular disease and cancer, but certainly in MS as well, showing differences in statistically significant differences in all these values. And then EGF being a significant factor, epidermal growth factor. And then the CD14, the CD34 cell ratio, and then the CD95, CD34 value as well. Both of these being significant contributing factors to what's going on with this autoimmune condition that's so difficult to treat from a conventional medical approach. So again, really nice findings here showing how these allopolysaccharides can modulate the immune system, lower inflammation, really significant findings here. So much like the same story with the BioBrand, we're basically showing that these allopolysaccharides are able to modulate many different types of biomarkers, whether it's an inflammatory marker or whether it's an immune function marker. Also in combination for the Alzheimer's study, the cognitive functioning data, which was so promising. I didn't show you in the MS, the quality of life, that was another paper we published, but in addition to the immune system improving and the inflammatory markers changing as well, we also showed really significant improvements in quality of life and functioning, which are also very important for people with MS. And then again, much like the hydrolyzed rice bran story, basically these allopolysaccharides have no adverse effects. They're not hypo-responsive, meaning you can take them continuously. They have negative interactions with medications or other dietary supplements. In fact, they likely make all of those other products work even better. Actually, aloe vera, I mentioned the concept of bioavailability earlier. Aloe vera actually also helps other nutrients to be absorbed by the human gut. So that's actually sort of a side effect benefit of the allopolysaccharide. So overall, what we're talking about here is that nutritional supplements are actually very important, even though many times nutritional supplements get a bad name, particularly from very dogmatic people in a conventional medicine paradigm. They typically scoff at or make fun of nutritional supplements. But when you take the right nutritional supplements, when you take key ingredients from foods in nature that have these benefits that could be even enhanced further with a dietary format, now you're getting into some really significant opportunity, particularly with health challenges. If you're healthy, if you don't have any real threat to your health at this time, you still want to take these supplements though. You still want to have these nutrients as a regular part of your routine, because as I mentioned, prevention is just as important as, if not more so, than people who have disease. The other really key point to this is that there is no magic bullet. You know, you have to do stuff every day. I mean, sometimes people ask me, well, you know, John, if I take this product and then I get better, do I have to keep taking it? Well, that's like asking me if you need to keep breathing oxygen. Of course you need to keep taking it. Just because you overcome something and now you feel better doesn't mean that the body no longer needs that. So again, nutrition is what we do. Healthcare actually is what we do on a daily basis. It's not just going and have your blood pressure and your cholesterol checked once a year. That's a tiny, tiny aspect of healthcare. What we do actually every single day. It's every decision from a behavioral perspective that we make. It's what we do to ourselves, with ourselves, for ourselves every single day. So think of your dietary supplementation or your nutritional regimen as just part of you. It's not a magic bullet. It's not looking for a one-time solution. It's not looking for that one key thing. It's looking for all the things that are important and then doing them every single day and following that routine. And then finally, a giant in the field of nutrition probably, has not been even remotely recognized as he should be in terms of his importance to the field. But he had this really famous quote almost 50 years ago: "The human body heals itself, and nutrition provides the resources to accomplish the task." I mean, again, that perfectly sums up what nutrition does for us, and unfortunately how we've jumped the track from a conventional perspective, what we term as healthcare, where nutrition is hardly even mentioned, and we focus on treatment of disease rather than actually preventing disease in the first place, taking care of ourselves. So thank you for your attention. Here is my email address and phone number at the bottom if you'd like to write those down, and I'm happy to send you this presentation or any of the articles I mentioned or anything else that you'd like to discuss. Thank you so much for your attention during this time.
Perfect. Thank you so much, Dr. Lewis. That was awesome. Thank you so much for all the valuable insights and all the information. I think it was really great. And we have two quick questions from the audience. The first one is, since your wife and you just had a baby, how healthy is baby food? Can you hear me? I think we lost him. Okay, I will definitely make sure that Dr. Lewis is going to respond to the two questions that we had. We will reach out to you after the webinar. And I really want to thank you for your attention and, attending our webinar today. And I really hope to see you in Miami Beach at FIBO USA, November 6th to the 8th. Thank you so much, Dr. Lewis, again.
Thank you.